Hi, and welcome to 52 Weeks of Health Equity. My name is Tahisha, and today I have the pleasure and privilege of talking with Daniel Greenbaum. He is going to be talking about his work and what he does and what he's passionate about. And so, Daniel, since I know you can introduce yourself way better than I can, I'm going to turn it over to you and allow you to introduce who you are and why you're here.
Well, thanks for that warm welcome. I am an attorney in Los Angeles, and I focus in my practice on personal injury, so a lot of motor vehicle accidents. But I also, in the last few years, have started to focus on bad faith insurance claims. And I've really, where I come to this health equity component is after handling and speaking to dozens and dozens, maybe more of people. I mean, that's the work I do now. A lot of what I do is file lawsuits on behalf of people against their own insurance.
So the CDC has this definition that health equity is allowing people, or it's getting people to the state where everyone has fair and just opportunity to be their healthiest self. And I'll even add in Robert Wood Johnson Foundation's their little caveat that says we need to be looking at reducing barriers, right? Like things like poverty, discrimination, the consequences of all that, including powerlessness and like racial inequity and access to good jobs and being able to have housing and quality education, all the social determinants of health that fall in there. And what does that look like when you don't have great environments or don't have access to healthcare? So you said something about bad faith insurance cases. Like, what is that?
Let me give you an example of a case I'm handling right now. We're going to trial in a few months. This is not in the health arena. It's all different types of insurance. This is someone who has came back to his car. He had gone out with his wife, and I think he went home and then got a ride in the morning with a friend, came back to his car after working a very long day, comes out to his car that he hasn't seen in over 20, that. He drives it, and that story, and he files a claim. And he says, hey, brings it back to the shop. It's not working, whatever it is. And he makes a claim. Now, the insurance company, to their credit, sends someone out and says, yeah, we'll pay for the body damage. Obviously, someone vandalized it. But we're going to trial because they're saying, the car just broke down. Coincident. It just happened to be that right an hour after your car was vandalized, it broke down. That's not related.
But so he has insurance. It's
So
not
he had
like
insurance.
it's not like a super old car or anything like that. And so he kind of had this faith that his car, like having insurance, is what we're told we're supposed to have, right? To like make sure it covers all those things that could happen, right? And so I know this isn't a health insurance case, but like you described, like he comes back, he wants to, like he's tired, he's worked a long day, like, and now you're thinking about all this stuff that you thought you took care of, and now having to deal with that has to impact your health. Like it's a stressor. Now it's like impacting your work, all the things that socially allow us to be healthy. Like now, it's that dominant.
But this happens also, for sure. But this also, I mean, like we could talk, yes, with all insurance, that's the problem, that things started changing. I don't want to go too deep. People definitely can do research, but the insurance industry, health, all over, changed about 35 years ago. There was a big shift in the 90s, maybe not even 30, moving up into the early 2000s, a big shift where the company started saying, how can we maximize profits? And look, a company exists to maximize profits. I get that. I may not agree with it in the way capitalism works now, but I get it. They're trying to make money. And the only way they figured out how they could make more money, they can't control the number of claims. They can't. And yes, they can try and sell.
That's why we have insurance, right? For the unexpected.
Right. They can't control that. They don't, that's going to change over time, but it's going to be whatever it is that year, that month. They can't control. They can try and sell more insurance. But ultimately, they're going to have whatever market share they're going to have. What they really can control, and what they realized, it started with Allstate and then it moved to others. And this is public. They hired an efficiency expert, McKinsey, an efficiency company, to help them. And what they figured out is what they can do is they can turn the claim center. So before 30 years ago, the claim center, the job of the adjuster was to come in, look, and say, okay, you have a claim here. You went in for this surgery, this or that. It's covered. Yep, it's covered. I see that. We cover 40% of that. So it was $100,000. We'll cover 40%, or we cover 60%, or whatever it is, right? And we cover
so it was straightforward.
Straightforward. Every expert I've talked to, and most of these unfortunately are older people because they were working 30 or 40 years ago, their experience when they were coming up was like, that's what you did. Right. And that's the point. I mean, not to get too, but like Ben Franklin was part of the first creation of the first insurance companies, like 200, whatever. Right. And the idea was when someone makes a claim, you pay out. One of the greatest stories I read in reading these books about insurance and how it's changed now was that when there was I don't remember when, and a lot of them were insured by some guy in Connecticut, whatever, Hartford Insurance. And it was the middle of winter, and he put the cash on sleds and brought it down to pay out. He said, I got to pay for
I don't think anybody thinks of insurance companies doing that anymore.
Right. So we've come a far way from someone saying, I owe you the money and I'm going to pay it because you paid it. It's the one thing we do where you pay ahead of time. You pay and you pay and you pay. And then you don't get the benefit until much later. And they get to decide if they're going to give you the benefit of the contract I'll give you an example in my family right now, what this is happening. I'll give you a personal example in health insurance, how this happened. So this is a perfect example. This is maybe 3 or 4 months ago. It did actually turn out that my 5-year-old did have COVID. But we went in. We didn't know he was, he had a cough or whatever it was, or he wasn't feeling well. So our pediatrician does a thing called a respiratory virus panel, an RV panel. They do 15 or something, right? Very standard. She said, you should do this, then you can find out what it is. Because let's be clear, while COVID is worrisome, I'm actually with a 5-year-old, he was 4 at the time, I'm more
tag on a little bit. I had what was suspected COVID at one point, and they didn't do some of the other testing, so I never knew what I was sick with. Did I have the flu? Was it nothing? And it makes total sense because you want to know what to treat for.
Right. Is it RV? I mean, we don't know. We also have, I have a history of asthma, so we should know about these things. I wasn't sick at the time, but let's all go in, let's get tested. Great. But especially my son who had symptoms, for sure he should have been tested. So we go in, and I do want to point out, there's also the other thing that happens between insurance companies. So a year ago, we were on a different insurance. We did this. It was waved through. There's no standard rules. The federal government has some of these rules, and we can talk about, for instance, with the mental health parity laws, that is another part that sort of is my big passion in this area of equity, health equity. But there's no standardization. So our old insurance covered it. No problem. We didn't bat an eye, waved it through. We hadn't been sick. Thank God we hadn't been sick. So now we're sick. This is October or whatever it was. And so we go through our new insurance. No. And we say
no. So it's
not at all.
Completely different practice. So so you almost need to be an expert in every single insurance company that's out there, their standards and protocols, and reading all that. And who has time?
But I don't think we would have even had time. Our doctor said, hey, we're like, he's sick. We need to know what he has, or if we have it, we're going to come in. She said, yes, that's what we want you to do. I want you to take this panel. We'll figure out what he has, but if you guys have it also. Because he'd been sick for a few days, so we might have gotten at this point.
So wait a second. The CDC says we should be aiming to be our healthiest selves, right? And we've been told that COVID, if you have COVID symptoms, go get tested, go do this, go get treated to protect the population. So then when people go to try to do these things, you hit blockers, it sounds like, to actually being able to do that, because nobody wants to walk out of like a doctor's office and end up with thousands and thousands of dollars worth of bills, right?
For four of us, I think the bill was $200, $175 each, and we got a bill from our doctor, and we said, "What? Why is this not covered?" And we go to our insurance company, and they say, "Oh, well, we're not covering it. It's experimental." And I said, "Experimental years, let's say, never heard such a thing. This is experimental." They're testing.
So wait, the panel is experimental. The test panel is experimental.
And so we appealed that. And so they came back. So I actually just recently got their final decision. And why this is how they determined it was experimental. They said, well, lawsuit on my own behalf. But they essentially, well, if you're testing for 5 or less, then it's not experimental. But testing for 10 or whatever, 15, then that's experimental. And it's not accepted good science. And it's not peer. I'm thinking, how would I have known that? Secondly, my doctor went to school, not you. This is the problem with insurance company. This is part of the problem, which I'm sure many of us have understood. And I think a lot of doctors have a problem with this, is doctors have to make the decision. They have to make a decision right now about, right?
And if they make the wrong one, they put themselves at risk.
Right. So which is why, right. So she, of course, said, I don't want your 4-year-old to have RSV or something else, because he could end up in the hospital. Let's get him treated quickly and find out. Right. He didn't have RSV. Right. And that was a relief to me. My wife worries more about COVID, but to me, it's crazy. That's part of, I think, what you talked about, access and fair and equity and all this, the things that the CDC health equity guideline talks about, is the insurance is getting in the way.
Yeah. And I just want to point out, you're a very smart guy, right? And so you're well educated and you kind of know these systems because you dealt with them before, from even like lawsuits and things like that. So for someone who is not as well versed in this, or doesn't have the time to like go and make these calls and all of that, like this seems like why people don't trust the healthcare system too, like, or what their doctors say. Like it adds to like me having less faith in what my doctor has told me, thinking that they don't know what's going on, because we often think doctors know about the insurance and like, hey, why order a test if it's gonna, if I can't get it? So it's almost like they're setting up the doctor for failure. And for those who don't have the time to navigate through the system, they're probably not going to proceed forward and either pay it or be in debt for it. Like, let's say you're a single mom, or you have very limited income. Like, how does that not become a snowball? That like why create a system like that?
Of course. Well, and my experience, both, I should say, so the bad faith is first party. That's when you have been wronged, to use, it's maybe not the most accurate term, when you have said, hey, my insurance, I have a claim, and they deny it. But I also see this, I want to be clear, in the area, I started seeing this, and this is in the area of personal injury with third-party claims. Now, again, this is not health, it's not health, but it does impact everything. Because the experts I've spoken to since getting into the bad faith area, they said it was also the same when they worked as car adjusters, right? So you hit somebody else and that person says, ow, starting a long time ago. They said it was, I looked, I got the medical bill. So someone would say, okay, I went to the chiropractor. I have a bill now for $5,500, let's call it, right? They turn it into the other person's insurance, the person who hit them. And he said, I would look at it and I'd say, yep, that's a bill. They went, yep, I see it's 100 times. They went 50, whatever, how it adds up to 5,500, 4. Now, every case is a fight. Every case they fight over whether or not that's reasonable. So now we have insurance adjusters who are in a car accident case who are questioning whether or not you going to a chiropractor because their client, their insured hit you, whether or not, should you have gone that many times? Did you deserve that injection? Was that injection? Did you really need that injection? And is that injection really that much? Is it really that much? And I've had doctors in
So you're supposed to bargain hunt for your health. You
have to bargain hunt, or you don't go, right? Because you don't know if the insurance...
Use it. which seems logical, right? Like you go to use it, that's when they give you kind of pushback. So
Hmm.
what is like this probably is why we don't really trust insurance in the United States. Like even when
Yeah.
the ACA Healthcare for Everyone came out, a lot of the pushback from people, friends I had was, well, why would I pay for something which I'm not going to use? Like, and so a lot of people didn't buy into it. Or I had friends who would say, like, I don't want to pay for something that when I go to use it, it's not going to pay for the whole thing, or I'm going to have to like provide like a whole bunch of stuff if I need to. I'd rather just roll the die and have to
Hmm.
pay for it out of pocket myself. So, aren't they in some ways, even though this is like a way for them to put profit over people, aren't they creating this sort of, as you said, like I'll use the word bad faith, even though, like a bad faith with customers and people
Oh,
out there so that
absolutely.
you don't want to get insurance if you can avoid it as much as possible?
Right. Or you don't make a claim, or you don't. I was told by the guy who's our broker for like our house insurance, one of the windows shattered. It was just like I'm super hot or something, and he told us don't make a claim unless it's. I think he said,
That
"What?"
is wild. That
I
is
was like, "Are you
wild.
kidding me?" Yeah. I mean, I think, and as you said, I think it's not. While of course, health insurance has a direct effect on sort of how healthy we are in our, but all of this, the unknown, of course, the unknown with if I get into a car wreck, is it going to cover this? I mean, that's something that happened just in California. We just updated our minimums, and there was such pushback from the auto industry, the auto insurance industry. They hadn't been updated, and our medical malpractice insurance coverage hadn't been updated. A hospital stay was a couple $100s a night, right? Now, to have a minimum of $25,000 or $15,000 for personal injury on for the bodily injury, one night in a hospital might be $10,000 or $15,000 depending on what they do. An ER with the ambulance with the doctor, you get all the different bills. All of a sudden, you go
Into this too, having worked in healthcare and seen some of what we charged insurance companies, they didn't pay that though.
right.
Like they paid like a quarter. Like
Mm-hmm.
we would send them a bill and they would pay like 10% of that. So like whatever they paid.
Yeah.
And it's a trickle down almost into like how great your healthcare will be, because if health insurance companies are paying a percentage of what you might pay, then they're giving that a smaller percentage back to hospitals.
Mm-hmm.
So in the United States, I think there was this myth too that medical care and all things cost so much. But some of that is probably with the idea that health insurance is only going to pay so much. Because if you're paying out of pocket, there's always that little caveat from the hospital or whoever's billing you, like reach out to you and will work with you. They will not work with you as well probably as they do with the insurance companies, where they have some negotiated rates going. But it's this like system of all these little nuances that the average person doesn't know about. And so who it harms, it sounds like, and who it prevents having access to healthcare and to saving your money that you thought you were paying into, like let's say you're paying into auto insurance, it harms the public,
Oh,
because like
for sure.
part of getting any type of insurance.
It's insane. We have I think there was a meme going around several years ago, about Breaking Bad that said, it's funny. Breaking Bad is the perfect example. It said, all you need to know about the American healthcare system is that one of the most popular shows of all time is about a guy who decides he has to, great show. But it's deeply accurate about the depths that people have to go to. I mean, that's one of the reasons. All of this experience for me, I certainly lean left, but all of this work over doing the personal injury and doing the bad faith and doing all the research on the history of what has changed, I am 100% on board with some type of universal health care. I think that it's a shame that we don't, and we know in the countries where they do it, there's just people are happier. We know in Finland and in England, and the biggest thing is that it allows people to not be worried if they don't have a job, if they, whatever it is, if they're over 25, so they can't be on their parents' insurance anymore, if they want to go back to school, if they want to pay for your own insurance, but most people can't.
Mm-hmm.
And we know that obviously if it's affecting me, middle-class white guy, and it's hard for us, it trickles down even worse to the working class and even worse to communities of color. And it just is good. We know in every area where things are bad, it's going to hit people who are in poverty and people of color so much harder. And that's
say that we care about, people having access to things. We say that we care about the working population here, and that we want everybody to work, right? But if and it's funny you mentioned Breaking Bad, like if working is more expensive than doing crime, like, because that's what he's doing crime to make his health insurance, like to pay for that, like where are we as a society? We are not leading the way in the US. And so I've talked to people too who are in other countries, and it's always so interesting when they talk about like the things that they kind of want to have as priorities when they talk health. So they're like, we would like to have holistic services. We would like to have more psychological safety. And it's funny because the US, where we think of ourselves as number one, right? We're saying things like, I would like to be able to have just a surgery that I need to save my life. Like we're not even thinking stress relievers or like.
And he had to agree, which was great, was that essentially the US does have the best medicine in the world. We really do have the best doctors.
The whole concept of laziness in the U.S. should not be a thing, because the U.S. works more out of their home, has, than any other country. There are countries right now that have 4-day weeks, consistently, that people are more productive when they have more time to recover.
More I read and think about these things, I mean, that is one of, I think, the issues with the philosophy of capitalism that is the problem. Again, I think there's nothing wrong with people wanting to have stuff and make stuff and be paid for that stuff. It's the philosophy that we've taken on that there's literally nothing that, unless you can make money off of it, unless it can produce, it doesn't have value.
Which might be why we don't take care of our children, right? Because they are unproductive for a good chunk of their lives. So, we do really poorly with child care services and how we care for children in this country. And we also don't do great when it comes to mothers giving birth, right? Like that's the least productive time in a woman's life. Like, but that is the time when you need the most support. So it's so interesting that you said that. Like, it's really about like capitalism is like, if you're not bringing in money, if you don't have monetary value, then why should I care? And that is probably why this impacts communities of color more in